It started in Flint, RX Kids, a little more than 2 years ago. The prenatal and infant cash prescription program has expanded to 60 Michigan communities. This program is a first of its kind in the nation. RX Kids data shows more than 13,000 families have enrolled. In tonight's Forward Focus, we look at concerns within our community and how RX Kids is benefiting people here. Here's how RX Kids works. Mothers get $1,500 during pregnancy. Babies get $500 a month for either 6 or 12 months after birth. People qualify if they live in the 60 participating locations across the states. Program founder and director Dr. Mona Hanna says they started thinking about this years ago.
I was really inspired by the expanded child tax credit during COVID, which was in 2021. And really it's kind of built on decades and decades of work around the world and in this nation that recognizes it's hard to have a baby.
LendingTree released a report in April. The data shows it costs a little more than $303,000 to raise a child in the United States. That equates to about $16,000 annually over 18 years.
It's expensive, it's physically, emotionally, just such a vulnerable period, and that we have this obligation to come alongside families.
Dr. Hanna is a pediatrician. She worked with babies for her whole career, and in Flint, through her research, she helped expose the Flint water crisis. Dr. Hanna knows firsthand how health can impact an entire community, which is why RX Kids is important to her.
We're seeing more mamas being able to go to prenatal care, and that's translating into better birth outcomes, less premature babies, less low birth weight babies, less NICU admissions. We're seeing a massive reduction in stress. This is once again a really stressful time in folks' lives, very much also because of that financial vulnerability of this time period. And that's translating into improved mental health.
A study published last month by the Lancet Public Health found that after RX Kids started in 2024, Flint saw an 18% reduction in preterm births and a 27% reduction in low birth weights. This contributed to a 29% decrease in NICU admissions.
We've been getting calls for over 2 years, right when we launched in Flint, and it's kind of it's amazing because 10 years ago, nobody wanted to be like Flint. And right now, everybody wants to be like Flint.
RX Kids has provided more than $48 million to families across the states. More than 10,000 babies have been born since January of 2024.
We built it in Flint as like a proof of concept, like, can we figure this out? Because it was never about Flint. It was always about helping kids and communities across our great state.
Their goal is to be available in more Michigan communities as long as funding allows. Money for RX Kids is currently allocated through multiple funding avenues, including the state budget and private philanthropic organizations. Also, we are learning the program is expanding to Ohio beginning this fall.